Hi, my name is Julie. I'm a student nurse practitioner with United States University. How are you?
I'm good.
What's your name?
Leah.
Can you tell me your day of your birth and the month?
The 23rd of February.
Okay, good. Can you tell me what year it is?
2019.
Can you tell me who the president is?
Trump.
Can you tell me what day of the week it is?
Thursday.
Good. Okay. I'm going to be recording this video for my school and to be uploaded to YouTube. Can I have your permission?
Yes.
Okay. And today I'm going to do your musculoskeletal assessment. During the assessment, if you have any pain, let me know. If you have any questions during the assessment, let me know, okay?
Okay.
All right. Are you in any pain today?
No. Other than my leg.
Oh, yeah, your leg. So we'll keep an eye out there. And if I get too close to your leg, let me know. I know you have an injury to it, so we'll try to be gentle to your leg, okay?
Okay.
First, we're going to start off with your hands, okay? First, I'm just going to start off by looking at your hands. I'm checking your fingers and looking at your joints, making sure I don't see any swelling. And I'm checking to make sure that I don't see any nodules, any redness. I'm making sure that the color is the same. If you turn your hands over for me, I'm looking at the palms of your hand, making sure that the color is good, making sure I don't see any injuries. Okay? Okay, you can turn back. Next, we're going to do range of motion of your hands. If you make a fist for me. Okay. Okay, good. If you open your hand, you can relax the fist. Okay, turn your hands over. If you open and close your hands like this. Okay, not like this. This and then close. Okay, so that's a flexion and extension of your fingers. So now if you point your fingers toward the ceiling, okay, let them back, parallel it down, towards the floor. Good. Okay. So she does have good movement on her fingers. Did you have any pain when you did that? Okay, good. Now I'm going to palpate your joints. I'm going to do the distal and proximal assessment of your joints, okay?
Okay.
Any pain?
No.
Okay. Any pain?
No.
Okay.
No.
Okay. Okay.
No.
And these are called your interphalangeal, and this joint right here, like these joints right here going between it, it's called your metacarpal phalangeal. Okay.
Okay.
Any pain?
No.
Okay. Now we're going to. We already did range of motion. I already did palpation. I'm just making sure because I go in a different order than I normally do. Now we're going to check your wrist. We're going to go ahead and just always start with assessing and inspecting the wrist. I'm just looking and making sure I don't see any joints, deformities, or any redness. I'll just put that up here. Any redness or any nodules on her wrist. So if you turn your hands over, I'm going to look at the wrist from the inside also, just making sure I don't see any swelling. Okay?
Okay.
Now we're going to start with range of motion of your wrist. So if you point your wrist toward the ceiling like this, any pain? Point down like this, any pain? Okay, now we're going to do ulnar and radial deviation, which simply goes like this, any pain? Like this, any pain? Okay. So now we're going to do some specialty tests. I'm going to palpate the your metacarpals of your wrist, okay? Just your wrist bones and joints. Making sure. Okay? And I'm checking for nodules. I'm checking for swelling. I also like to check to see if anything is soft. And I had a patient one time that when I was checking his joints, his hip, they were really, really soft. And we ended up sending him to the emergency room with deep tissue injury. So a lot of times I like to check that, make sure they're not soft. And then we're going to do the tendons test. The tendon test is for carpal tunnel syndrome, to evaluate for carpal tunnel syndrome. When you being in college and have to do a lot of writing and typing, sometimes you can develop carpal tunnel syndrome. So we just better tapping. Any pain? Okay. So now we're going to do the Phalen's test. The Phalen's test is about what we call, it's like praying, but it's upside down. And we'll get you to hold your hand there for 60 seconds. Usually this test is 40 to 60 seconds if they can tolerate it. Are you having any pain doing that? And you can do that pretty good too. Better than me. All right. You can let your hand down. Now I want you to make a fist. Any pain, you make a fist. Okay, good. All right. So look, it looks like your wrist and your fingers are intact. I also want to check the extension of the tendon right there. It's the extension. Any pain with that? Okay. And you have one that runs right there, and then you have another that kind of runs right in there. Any pain with that? Okay, good. Now we're going to go ahead and move on to your elbows. Now we're just going to look at your elbows. I'm doing an inspection of the elbows, making sure I don't see any swelling, any redness, any nausea. Also making sure I'm looking at both sides to make sure they're looking even. Now we're going to do the range of motion of your elbows. If you straighten your hands out for me. Okay, now we're going to pronate, super pronate, pronate back up. Okay, any pain to do that? Okay, that's just checking to make sure that you can move your elbows without any problems. And now I want you to bring your elbows up like this. Okay, push with your elbows towards me. Okay, and don't let me pull. Okay, good. Good, and that's just checking, making sure that you have good strength, that you have any pain in your elbows. Okay, that was, now we're going to do the palpation of your elbows. And I'm checking the lateral epicondyles to make sure that there's no tenderness, any pain like that. And sometimes if you have pain with that sign of tendonitis, and then right here, pain right there, and check the medial and the lateral. The medial will be a sign of golf elbow. You play golf? Okay, and then we're going to do both sides. And we're also palpating the joints. And then I'm checking the olecranon process, which is just the tip of the elbow, like that's it right there. Okay, and then you got a nice little joint right there that we check also. Any pain with that? Okay, good. We're going to check the olecranon process on this side, and then we're going to check the joint. Any pain with that? Okay, and I didn't feel any softness or bogginess, which, I like to look out for just in case of fluid. Okay, next we're going to move on to the head, and then and the neck. So I'm going to look at your neck and just making sure that I don't see any abnormalities. The trachea is midline. Just looking, making sure I don't see any swelling, any nodules. Okay. Now, can you touch your chin to your chest? Okay, good. Okay, take that like that. Good. So that's an extension and flexion of the neck. Okay, touch your ear to your shoulder. Any pain with that? Go back to this side. Any pain with that? Good. Now take your head and go around like this. Okay, good. Any pain with that? Any dizziness? Okay, good. Now we're going to check your TMJ. Okay, open. Close. Okay, good. Any pain with that? Okay. Like this side to side. Okay, she got a little loose there. Any pain with that? Okay. Now, can you do this? Any pain with that? Okay, good. All right. Good job. Now I'm going to palpate your cervical vertebrae. Okay. Mm-hmm. And I'm checking the inner joints to making sure that I don't feel any joints out of place. And I'm also looking at C7, which is the most prominent bone, just like right here. Any pain with that? Okay, good. All right, that completes your head and neck. Now we're going to move on to your shoulder, okay? And I'll start out by inspecting her shoulders, making sure that they're even. Also making sure that they're symmetrical and that I don't see any swelling or anything that's abnormality with her just on inspection. And you always want to look from the front, and you always want to look from the back also, or from the side, to just make sure everything looks the same all the way around. You got a little more right now. So now I'm going to do range of motion, okay? So if you put your arms out to the side and bring it back down, in pain with that, that's abduction and adduction and abduction, okay? If you lift your arms above your head like this and put them back down, okay? In pain with that, okay? If you touch stand up for me. If you touch the lower part of your back, okay? Okay, do the other side. In pain with that, okay, good. If you take your hand and put behind your head, in pain with that? Okay, that's internal and external, and then that's posterior flexion and extension, okay? And then if you turn around this way and try to touch your scapular. This way. Put that chin right here. In pain with that? Okay. And then do this side. In pain with that?
I can't do what I did the other way.
Okay. What does it feel like?
It's tight.
It's tight. What about is it tight at? Okay. So she does report limited mobility with the right arm when trying to touch her shoulder blades, her scapula in the back. Okay. Next, we're going to you can have a seat. Next, we're going to palpate your joints. Okay.
Okay.
Before we palpate, let's do the cross shoulder test, cross arm test, which means you bring your arm across your body like this to one side. Okay, just like that. That's fine. Just like that. In pain with that? Okay. Now do the other side. In pain with that? Okay. Now we do the Hawkins impingement test, and this right here just lets us know if you have any impingement on any of your nerves. So what we do is take your arm. And you kind of support your arm like this in mine.
Oh, sorry.
And then what I do is kind of twist it the opposite way. Like I'll have your hand here and I'll put this way and then that way. Okay. And I go that way with it. Okay? Okay. Any pain with it? Okay. Good. And then we do the same side on this one. Okay. 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 Good. Now we're going to go ahead and do the palpation. Okay. Now this may be ticklish, so I'm going to go ahead and touch you a little bit because you used me touching you. Okay. So we're going to start. I started the sternum notch because I want to do the sternal clavicular joint, which is right here at the end of the clavicles. And just kind of palpate that. And then we're going to go all the way. Let me get this done because she's about to start laughing. Go all the way up to the end of the joint, which is your acromioclavicular joint, and just kind of check it out. And that's going to be right here, okay? Then we're going to come down to the tubercle joint, which is like the humerus. It's right at the end of the tubercle humerus. It's like if you move your arm right here, it's like where you can feel it changing. We do both sides. Okay. Okay, once we find that, then we move over to the coracoid process, which is like right in there. And we don't want to mash that too hard because I did it earlier. And she's like, ow. Okay, and we do that on the same side. Like right in there. I feel like a knot. Okay, then we come down to the, we're going to check the subdeltoid bursa, which is right here. Okay. Okay, good. Okay, okay, good. And then we're going to come down and we're going to check the bicep first. Fossa. Right there. Okay, good.
No.
This is the bicep fossa. Okay, okay, good. And now I'm going to go ahead and check your trapezius muscle. I'm just going to And then we're going to check the rhomboids. If you turn that way a little bit so towards the camera so they can see. And the rhomboids usually runs along here. And we're just palpating that, making sure along that clavicle, not the clavicle, the scapula, that we don't have any problems. I don't feel any abnormalities. Now, when I'm palpating, I'm always checking to make sure I don't feel any nodules. I'm also checking to making sure I don't feel any masses. I'm checking to make sure the joints are not out of place. Okay? And also I wanted to make sure when I'm looking that I don't see any red joints, like, something that could be in your finger, like a sign, that could be a sign of inflammation or rheumatoid arthritis or any deformity. Most of that's found in the elderly or as you get older. And we don't have to worry about that right now with a 19-year-old. Okay? So next we're going to go ahead and we're going to move down to the lower part of your extremities. And can you pull your, I don't know if your pants can come up a little higher so I can take a look at your knee. I'm not doing it right now, but eventually I'm going to be doing an assessment on your knee.
Both ways?
Please. Okay. Okay, good. So first, if you'll lay down for me, I'm going to do this with you laying down for the camera because I have to check your feet. I'm going to take your socks off if you don't mind, do you?
No, ma'am.
Okay. I'll put them over here. Okay, so what I'm going to check down here, I'm just going to start off with inspection. I'm just going to look at her feet in general, making sure I'm looking at her toes, looking at her ankles, just looking at her feet, making sure I don't see any nodules, I don't see any swelling, I don't see any deformity of her feet and her ankles, and I don't see any swelling. I'm also going to check the curvature. I'm looking for a pillow to put your leg on. She has an abnormality on that leg. So she has a sore on that leg, so we're gonna put a pillow to support that leg to make her comfortable. Right now I'm gonna check her feet. If you notice, her feet, can't hardly tell that good from this angle, but she does have a nice curve to her feet. Normally you check the feet with her standing to make sure she's not flat-footed, but she has a nice arch in her foot. So right now I'm going to go ahead and check the metatarsals, and I'm going to check the distal and proximal joints on her toes. Okay. Tickle.
Yes.
Well, that's tickling is good. At least we know that's not hurting. And then I'm checking to make sure she doesn't have the neuroma, the neuroma in her feet. Okay. Then we're going to check the top of the feet. And anytime you start any procedure, I always want to make sure you wash your hands. I didn't say that at the beginning of the video, but I always want to make sure you wash your hands. Okay, now I want you to spread your toes. Okay, now close them. Okay, good. Now point them toward the ceiling. Now point them towards the floor. Okay, good. So she does have good range of motion on her toes. Now I'm going to go ahead and inspect the ankles. I already inspected the ankles when I was doing the toes and the feet. And now I'm going to go ahead and palpate the ankle. And I'm going to palpate the Achilles. And when I'm palpating for the ankle, I'm checking for nodules.
My leg.
Okay, I'm sorry. I'm palpating the, checking for nodules and also checking for swelling. Now I'm going to palpate the Achilles. I'm checking for nodules. Is there any tenderness? And checking for tenderness. Do this one right here too. Any tenderness? Okay. No tenderness in her ankles or her legs or her feet. Okay, if you'll sit back up for me. And remember, not to. I want to go back on the hand. I forgot to do the the snuff box. So we're gonna check the snuff box, and here's what we check to make sure we don't have any fractures. It's right here. Let's see if it's right in there. Okay. Okay. Any pain? Okay. So glad we remember that. Okay. Now we just looking at the knee. I'm just inspecting the knee, making sure I don't see any swelling. Making sure that one side is not bigger than the other. Making sure that the kneecap is visual. Okay. I'm making sure I don't see any redness, any deformities. Okay. So now I'm going to do range of motion of the knee. And it's just a simple range of motion. You just straighten your leg out and bend it back. Okay, good. Flexion and extension of the knee. So I'm going to check the popliteal fossa on the right leg, but I'm not going to check the left leg because this is the leg that she has she's being treated for an injury on that left leg. And I'm checking for a Baker cyst. Okay, good. Any pain with that? All right. Okay. Then we're gonna go ahead and move on. If you're go ahead and lay down because we're gonna do. Oh yeah, let me put the pillow back. She's kind of limited on some of the tests that I could do. So now I'm gonna do a couple of specialty tests. I may have to look at my paper for the specialty test for the knee. I'm going to do the vagus stress test with the knee slightly flexed approximately 20 degrees. So what we do is I'm going to take my hand and I'm going to put it on the inside of the thigh, and then I'm going to try to, as I push this way, I'm going to pull towards me, okay?
Okay.
So you just let me know if that hurts, okay? Okay. And that right there tests the elasticity of the joint, and also if she had any pain on that outside ligament, which she did not have any pain. And then I'm going to do this on this leg, but I'm going to kind of be gentle with this leg. This is known as the varus, the varus stress, okay? Okay, no pain. Okay, she didn't have any pain with that. Now we're going to check the Lachman's test. Well, I'm going to hold the femur and the tibia, and then just kind of twist it. I'm sorry.
Okay.
I'm just testing that knee. All right? And then we're going to do the same thing. This is known as the Lachman's test. Any pain?
No.
Okay, good. And then we're going to do the drawers test. Okay, I'll just, if you bend that leg up for me, and then bend this one, we'll just do this one. And what you would do on this test, you kind of sit on the bottom of their foot, and then you kind of hold the knee, like in the center, with your hands on both sides of the knee, and you just kind of pull the knee towards. And what you're doing, you're checking to make sure that she has good strength in that knee. And I didn't see any loosening or the ligaments. Everything seems to be firm. Won't do this leg because she has the injury on that leg back there. Okay. Next, we're gonna do the McMurray's test, and that's just like a rotation of the. Let me just do this leg.
Okay.
Of the knee to make sure that it's just kind of checking that knee and making sure that it moves back and forth and it's not too loose, which hers looks just fine. Okay. Do you have any questions? Okay, and I'll put this back over here. So I don't need that anymore. Okay, let's stand up. So we're going to move on to the hip. So when she stands, always start out with inspection of the hip, making sure that everything is in place. Turn around that way. So we're just checking, making sure that one side is not higher than the other. Hers is a little bit because she's compensating because of her leg, but not because of her hip. So if you look at her hip, if she was to stand up straight, you can tell that they're in place. And then you also want to look at her butt creases at the same time you're doing that. Okay, you can lay back down. It's a lot of laying down and getting up. Okay, right now we're going to do the hip flexion and extension. So if you bring your leg up and put it back down. Okay, if you bring the other leg up and put it back down. Okay, now I'm going to do it for you. Okay. Just slowly. Okay.
Oh.
Okay. Go ahead. And while I'm doing it, I'm listening for popping. I'm looking at her face to see if she's showing any sign of pain. And I notice she does have more flexion and extension in this leg than she does in the left leg than she does in the right leg. I think because she's compensating for that leg right now. And I'm also checking and making sure that I don't hear any grinding. Sometimes grinding if somebody has problem in their hips. If you turn to your left side, oh, I'm sorry, turn it back. I'm sorry. I'm not finished with my range of motion. Okay, now if you bring your left leg up to the right knee, see what it, and then let this leg fall back on the table as far as you can go. Okay, any pain with that? Okay. Right. Okay. And see if you can do that same thing. Just kind of bring it up. And this is called internal and external rotation. Any pain with that? Okay, no. Good. Okay, turn over on your side. And now I'm going to check the iliac spine and the radial-trochanter joint. This is known as the hip joint. So I'm going to massage. I'm going to palpate. And then we're going around. We're going to go around to iliac spine. She's ticklish. We're going to do the anterior too. And then we're going to do the posterior. And we're checking the sacroiliac also. Okay? No. Okay, we do that on both sides. And we also check the anterior spine. And come on. I can feel yours good because you ain't got no meat on you. And then we're going to check the trochanter, which is right here. Any pain with that? No. Okay. I'm just going to lift this leg up to make sure I don't feel any. And anytime that I'm checking the joints, I'm also checking for crepitus. I'm also checking for, like I say, softness of the joint to make sure I don't feel any fluid in the joint. Okay? All right. If you can turn over on your back. And I'm going to get my paper for the specialty test for the hip. Make sure I didn't miss any of those. Okay. So this is known for the hip. This is known for a Thomas test, and we do a Thomas test, and we do the Patrick or Faber test. So what you would do, you would pull your right knee up against your abdomen, and then. Any pain with that? No. Okay. You can straighten your leg back up. Okay. Any pain when you did it on your head? Okay. Good. And then that was the Thomas test, and then you do the Patrick's test, which is we already did the Patrick's test. That's when you have put your leg up there. So we already did the Patrick's test. Okay. Now we're gonna have you to stand up so we can look at your back. And we already did the cervical spine, but I won't lift her shirt. But what we're looking at, we want to make sure that the spine is straight, and we also want to make sure that the scapulas are even, which hers is, and we also again want to make sure that we don't see any joints out of place. Okay. Normally you would have a gown on, or sports bra where we can see all that. Okay. So now what I want you to do, I want you to bend forward towards me. And I'm just looking at her spine, making sure I don't see anything crooked. Everything looks straight. And then, okay, we stand back up. And she was able to bend over pretty much all the way down. Okay, now flex back. Right. Any pain with that? Okay, good. Now turn side to side. At your hips. Any pain with that? Okay. Now lean side to side. Go one side, next side. Any pain with that? Okay, good. All right, then. So we just checking that, making sure that she has good movement in her spine. Let me check to see if I have any specialty tests for those. No, we do not have any specialty tests for that. But it's one more specialty test that I wanted to do. Okay. But if you face the camera, if you face the wall that way with your back this way, if you can, normally you'd be sitting for this position. This is known as the Sperlin's test, and if someone comes in with pain, this is how we tell if they have impingement. And so what you do, whatever side they're having pain, like if you say you was having pain this way, I would have you to lean your head that way, and I would come up and put my hand over your head as in like an A, and then I would kind of mash down on it. Now we do not, okay, you can sit down. Now, we do not do that test in the elderly and frail patients and people who have osteoporosis, because we do not want them to be broken. They came to us whole. And I'm thinking that's complete the exam. Do you have any questions?
No.
Okay, then. Thank you.
Thank you.
And I hope you get to feeling better.
Thank you.